Hello everybody, and thank you so much for joining us for our webinar today on improving laboratory flow with simulation. We're delighted to have you with us today. My name's Claire Cordeau. I'm the lead for healthcare at Simulate Corporation. So with that, I'm going to introduce to you Tom Stephenson. Tom is our Simulate senior consultant who works in healthcare. He leads the healthcare team here. Some of you may have come across him, either he's trained you or you might have spoken on the phone to him. So he works all over the world. He concentrates mostly on healthcare simulations, which makes him a real expert. Probably clinical flows, population health, disease pathways, operations are the types of questions that he tends to model. I'm going to hand over to him now to take you through the webinar. I hope you find it useful. I found it fascinating when I heard the preview, and we'll come back at the end to take any questions that you have. Over to you, Tom.
Thank you very much, Claire, and hello everybody. So just to give you a bit more information about myself, actually, I've been a consultant for a little over 5 years now, working in healthcare the whole time, so I've worked on a number of different simulations. In that time, and especially recently, actually, I've seen a growing need to test any changes in laboratories. I've worked in quite a lot of different projects across the globe, and I found quite a lot of common elements whenever I've worked on any lab simulations, all in different types of lab work. So some of the projects have varied significantly, and I'm going to take you through a few different examples of that today. So we're going to start by looking at why you should use simulation for a lab, what I've found particularly useful about this type of software. And then I'm going to go for a few common uses. So looking at new machinery, if I add a new machine to my process flow, how is that going to impact queues? How's it going to be utilized? And also how's it going to affect the whole system? I'm going to talk about optimal layout. So whenever we have to change the layout of a lab, maybe we're centralizing some of our lab services and we need to redesign that lab. Looking at demand changes as well, so with a growing number of samples that might need to be tested, how we can include that in a simulation. Taking it a step further, actually, we've done some work on total lab automation recently, and obviously that's such a big investment if you're doing that, but we know that it can bring a lot of benefits, and Simulate can really show those benefits. And then importantly as well, or maybe the area I work in most, is looking at labs in relation to hospital flows. So whenever patients need test results to come back quickly, they're relying on the lab, and we don't want to increase that waiting time where we can. I'm going to actually hop into a simulation at the end as well to show you some techniques, do some kind of how-tos on things that I've found really useful when building any laboratory simulation. So why use simulation? I think the first real benefit is the visual element you get. So you can build the simulation up to look like your real system. A lot of people will drop floor plans onto the simulation and build it over those, and when you've got that, it looks exactly like your real system, so you can really understand what's going on and see any queues building up and really relate to it. So if you're sharing that with colleagues, it can increase engagement, it can mean people ask the right sort of questions, and we can get some really good communication. And sometimes that even means that you've kind of found the solution before you've got the results from the simulation, just from that better discussion that you might get. Overall, we hope this visualization is going to bring better solutions. We need to capture the variability that happens in a lab, and I think Simulate really lends itself to that variation. So, you know, we're not going to get samples evenly across the day. We might have, just as patient flow varies throughout the day, we might have more samples at different times of the day. If we're working on a larger, more central lab, you know, we might have deliveries of bulk samples at certain times. So Simulate easily allows you to capture that variation, which is really important if you want to see how your lab's going to work in real life. We can include any complex logic and rule sets. So there's going to be a lot of logic, things like how many samples should be loaded into my machine before it starts. Just because your machine can load 100 samples at a time, should you do that? What happens at the end of the day? What happens at the end of a staff shift? All of these rule sets we can build in. You know, also things like resampling, if a certain percentage of samples have to go around the system again, and we know that might vary from by sample type, we can include all of that information into the simulation. I think it's really important to think about the whole system as well. So if I'm building a lab and I'm looking at one machine, it's very easy to just focus on how will that machine work, how many parts can it get through, what will be the waiting time for that new machine. But if we are implementing that new machine to maybe remove a bottleneck, it could be that we're pushing that bottleneck elsewhere. So our whole system might not even improve that much, and Simulate can help illuminate that. You can get results such as throughput and time in system as well. So some of the common uses, I guess a fairly common one is looking at that new machinery. When you're changing a lab, there's going to be a lot of different options out there. There could be, you know, different brands to choose from, completely different machines, and knowing which one you need is going to be vital. You know, it can be a very significant investment, so it's important to know the true impact before you make that investment. So we see people who are looking at buying or adding a machine to their system using simulation. We also see people who are trying to sell their solutions using simulation because of that understanding you can get from seeing the new machine in your process or in another process. It really helps to get buy-in for that selling process. So when we're doing this in a simulation, we want to look at things like the waiting time. We want to look at how utilized the machine will be, how many parts we can get through. But also we want to look at the rest of the system. Is it going to just move the bottleneck? If it does, how can we then make the system work well? How is it impacting time in system, and how is it impacting results against targets as well? So just one example of a project that's been done really well looking at this was when we were looking at a histology lab in an anatomic pathway, comparing tissue processes in this pathway. And this was being built by the company who would make the tissue processes. And in this example, it was really useful because it was a system that had quite little standardization, not many standard processes, a lot of variation, and that meant it was maybe difficult to collect any data. So the advantage of using Simulate for this one is that where there was no data, we could build a simulation that could help thought and insight where we didn't have that data. Also, there were comments that the visuals really helped get buy-in to making the change. And importantly, it can reduce the risk of adding that new machine. I mean, you can take this further and you could look at total or at least partial lab automation as well. We know that probably in the future, a lot of labs are going to be largely automated as technology gets better. There's going to be more and more pressure to kind of move to this total or partial lab automation system. And that's really good because it can get you faster results, it can get you more accurate results, which are better for the patient. We can remove any human error, so you know the results are going to be more reliable. And it can actually free up your staff to be able to do the more interesting work and not have to do any repetitive and boring tasks. So again, if you're using a simulation, you could look at what's the speed of access to results, how's that going to improve with lab automation, how's it going to impact my staffing requirement as well. So we might not need as many staffing members, and we can look in the long term, it might be a costly initial investment, But overall, if we don't need to rely on staff and as much rework and things like that, the cost benefit could actually be a positive one. An example of a client who's working on this problem at the moment is Sysmex, who are in partnership with GLP, and they produce a really cool track system where the samples move around the lab in kind of small cars. And this system is really good because it allows like modular solutions. It doesn't mean people have to use one brand for all their machines. So, you know, it integrates really well. And what they're looking at is how basically their track system can improve a lab process, and that can translate to small, medium, or large labs. And we're starting to find some real benefits of using simulation to show this. And this is a project which is continuing today, actually. Next, we can look at any different layouts and demand patterns. So, I mean, now I guess there's more of an emphasis on how you can make your lab more efficient, how you can deal with more samples in the space that you've got. We do still see some people who are thinking about, you know, expanding their lab, or at least moving their lab, the room in which the lab is in. So if we're doing that, again, we want to test it to see how it's going to work. We want to be able to see if it's going to process the samples well, but also that it's going to be friendly for the staff. So some of the examples of this might be, you know, reconfiguring machines, bigger or smaller labs, seeing if we're still going to be able to produce the results we need to, or testing demand changes. So, you know, if the demand is changing, what's going to be the limiting factors? Which part of the process is going to be my bottleneck? Really, we need to know with any of these changes if you can still meet your targets. You know, a lot of people as well are outsourcing at the moment. Obviously, it might mean that it might save a lot of cost. It might increase the time it takes to get samples back to patients, though. But really, without knowing that in detail, it can be quite difficult to make that decision, and that's where using simulation can really help. One example of this was a large pharmaceutical client we were working with, and they were looking at the effect of positioning an accumulator ahead of a cartoner and then testing that with different throughput rates, so testing it with various capacities for the accumulator to try and decide if we reconfigure this, what capacity should we go with. Now, when we looked at this, we found that there wasn't a huge difference actually in terms of the best capacity to choose, but getting it towards 10,000 capacity was where we saw the most efficient use. So that could lead and steer to which capacity works best in this configuration. If we have any more capacity, it's probably not going to help the system at all. And those are the types of results you can use to help decision making. Looking at this in a slightly different way, BJC, we're looking at two different layouts. You can see the two different layouts at the bottom of the slide there. And really they want to see which design is going to work best, really in terms of staff movement and you know, being able to move efficiently and reduce waste. So some of the results that you got from that were reducing staff travel time in the sort station by looking at the typical paths that staff walk through, and that was a 37% reduction. It helps determine the right staffing level as well, when you can look at how many staff are needed to operate the machines and also how much time is spent moving around the lab. You can really get a lot of good detail about the right staffing levels at different times of the day. So finally, a good use of simulation, and the one we see all the time, is the impact on the hospital. So it's really important that any patients get their results accurately, but also as quickly as possible, because we don't want to block the flows in the hospital, especially when there's such strict targets all over the world, strict targets around especially emergency departments and things like that. We don't want to do anything that's going to stop the flow. So simulation is really good for this. because it allows parallel processing to be tested, and I'll show you an example of that when I hop into the software later. We want to be able to isolate the time taken for waiting for test results as well, and that's something that you can do with simulation, because a lot of the time we might just see that a patient's been delayed if we look at a lot of data, but not really be able to know why. So including this parallel process and seeing how long it takes is really good for highlighting the impact on the patient. One example of this from a UK emergency department in London, they were looking at their new design for their emergency department, looking at all their different flows, but also included in this was a separate diagnostics pathway, which you can see on the right has got quite a lot of different activities there, including things like x-rays, CT scans, and all the blood testing as well. So whenever patients need that, we can say, based on the different patient types, what's their chance of needing to have samples go to the lab, and then how long does it take, and therefore what is the time holding up the patient flow. So if you've got something like this, it's really good to be able to see what the delay is and then experiment with what, if you change the system, how would that reduce your delays in the hospital, and how can you do better against targets because of that. So in any of these laboratory simulations, there are a few results that I think are really useful all the time. If we're looking at improving one area, we want to look at the utilization of that area. How is it 100% utilized? Is it 50% utilized? What do we need it to be, and how does that change over time? We want to look at how long samples are waiting, and that can be based on different types as well. So you can have what's the maximum waiting time, the average waiting time, or crucially the time within a limit. So when you have a target time to turn samples around, what percentage of the time are you within that, and when does that change at different times of the day? Also, we always want to look at the system. So, you know, what's our throughput, what's the average time in the system, and what's going to be the cost as well. By looking at all of that, it's going to give you a really good evidence base for making the change or not making the change that you want to make. And all of these results are actually standard results within Simulate. So it's really easy to collect these. These will be collected automatically every time you run a simulation. We always like to have some results on screen as well, so you can visualize. You know, we've got utilization charts here that show what percentage of time we're working or waiting, which is going to help you see which parts of the system are most busy. And this is obviously going to change. So if you make a change to one part of the system, it's going to change the utilization elsewhere. So being able to see that as you make the change is really powerful. So I'm going to now step into Simulate to show you some of the techniques that are really useful. If you're already building labs, you'll hopefully find some of these very applicable. So I've got a really simple automated lab here. So I've got my samples are going to come through. If I press the play button, we should start to see them moving along. They're going to come in to our centrifuge, go on, be decapped into our aliquot machine, into our rack before leaving. So it's a really simple linear process. I'm sure most processes in the lab are a lot more complex than this. I'm going to run this through for a week. So all it is just a simple linear flow without much detail right now. But what I'm going to do is add some detail to the system and show you how you can do that really well in Simulate and really quickly as well. So the first one is the day planner. This was a technique that I think a feature we built maybe 2 years ago now, and what that does is it makes it really easy to capture that variation in arrivals that happens every day. So if I look at my start point, I've got this option to use the day planner, and I can choose whatever interval I want. I'm going to choose an hour, so I can see this lab's only running 9 till 5, and I can say how many samples do I expect to receive between 9 and 10, 10 and 11, 11 and 12. on each day, and that might vary every day, but what's really nice about this is you can quickly put any of those in, and the simulation will automatically respond at different times of the week to these arrivals. So if I click OK there, the other good thing about that actually is when you use that feature, it creates a spreadsheet with the information in. So that makes it really easy to link to things like Excel, where you could just have loads of different schedules put in, and you could easily copy and paste them into here and test them very quickly in a simulation. The next thing, oh, I've gone too far. Let me just come back round the loop. Is prioritization. So we are going to want to prioritize some samples over another at certain times of the day to enable us to meet targets, really because we assume that some patients need those results back very quickly. So what I've got here is a little a queue setup for this centrifuge. Now I'm going to set a priority here just to show you the technique. I've got 4 samples coming in, and it's randomly type 1, 2, 3, and 4. And again, I've just got this checkbox that allows me to prioritize based on that value. So what that's going to do is it's going to put the highest priority at the front of the queue, meaning the highest priority should get through the queue quicker. If I rerun this simulation now, what's going to happen is I'll pause it. So I paused it here. In this queue, if I look in there, I can see at the front of my queue, I've got a type 4, then a few type 3s, then a type 2. So they've automatically reprioritized themselves in that queue, so that we'll see how that impacts flow. I'm going to run that through again quite quickly now. And what we can see, what's really useful is not only can you prioritize very easily, but you can see the impact really easily as well. So I can see my average time in the queue here is about 101 minutes. For type 1s, it's about 111 minutes. For type 2s, 104, 98 for 3s, and 82 for 4. So there's quite a big difference now between my type 1s and type 4s, and by refining this you can really make it accurate to real life and see how your different samples are going to get through the system compared to their targets. Not only you can do that in the queues, but you can also do that in terms of the timing system as well. So again, I can see how long have my type 1s, type 2s, type 3s and type 4s spent in the system, and it will probably be quite a significant improvement as we move higher up the priorities. So the next one that's quite useful is setting any collect rules. So a lot of machines in the lab aren't just going to sample one sample at a time. We're going to wait until we've got a buildup of maybe 4 or 5 samples before they start going through the system. And we can control that really easily and simulate. So what I've just got an example of this as a simple one for the centrifuge, where we should see as I run it that the queue will build up until 10 samples are available, and at that point it will collect the samples and move on. So that's a really simple collect rule. Now I could change that number. So if I wanted to play around with different capacities, I could easily change that number. But there's some other ways I can do that that are really effective as well. So if it's going to vary depending on the type of sample that we've got, I can use a sheet, and I can say, if I just create a new one, I'll call that collect. What I could say is that my type 1s, I need to collect 3 of them. My type 2s, I need to collect 4 of them. So I would just add that to this spreadsheet, and again, the simulation will automatically respond to that. I can do things like set this collect to all as well, using all, which is a kind of hidden feature that not many people know about. But what that could do is at certain times of the day, if you want to change the rule, you could quickly change it to collect all the samples that are waiting and run the machine before it's at full capacity. So we can use them and change them to really put in the rules that you might see in a real system. The next one that's really useful for looking at hospitals is a batching. And what we mean by batching, if I come to this different view here, it's all about parallel processing, really. So I've got, whenever a person comes in and say a blood sample gets taken, we want to be able to say in parallel the patient can go and have any other tests or go to their cubicles and wait, while at the same time the laboratory is working. And then what we can do is we can say that the patient is going to be waiting here, and the time that they wait here is the time waiting for their samples. So to do that, all I need to do is on this one say there's going to be 2 units that come out from here. So there's going to be the sample and there's going to be the patient. And I'm going to say you can't leave the system until both of them are available by using this collect rule. Now, when I've got that in my system, what I should see is that these 2 queues, if I just pause the simulation, I can see these 2 queues are building up at a very similar rate, and that's because all of these people in this queue are waiting for their lab test to come back. So if I was to reduce the time it takes for the lab test to come back, I would reduce the time that patients are waiting here. And you could add a lot of detail to this lab, to look at all your staffing requirements and things like that. But importantly, whatever change you make, you can see the impact on the patient, which gives a really powerful message to improvements for any lab. I always like to use a background image as well on a lab. This goes back to that visualization element we were talking about, where if you can have a visual that's going to represent reality, it's going to mean people can relate to it really easily. Now, I've done this in a really simple way. I've only spent 5 minutes changing this, but this is the same process that you saw at the start. The only difference is I've changed some images slightly. I built a wall around it, but instantly you should be able to relate to the system a little bit more. And you'll have to excuse my artwork here. It's not the best, but other people have done this really successfully. If in this example here that was done by BJC, we can see we've got a floor plan on there that's instantly relatable, and you can see the samples moving around it. You can see any queues building up, which is really quite powerful, and it really does help when you're showing this to get that engagement. You can even make these 3D as well, so you can make these look very 3D and see samples moving around them. I'll run this through to the end. So the final one is a bit of a bonus feature because it's not really useful for everybody, but if you were a company that, say, is building lots of labs, showing the impact of a lot of different labs, maybe you make equipment or you make total automation simulations and you want to keep using your feature in a simulation a lot of times, is we can store components. So if I hop to a new view again and look at this, so this is a component. Let's say this is the inner workings of my machine. I built a lot of rules into this about when it collects samples, about how long it takes to process them, and I know that I'm going to want to build other simulations that have this same configuration. So I might want to store that as a reusable component, and the way I do that is by selecting this whole process, and I can create a component. So now that whole process is within this one building block, and I could put that into any simulation. Now what's really good about that is if I want to reuse this in completely different simulations, I can come in and I can look at my properties, and and I can make this a reusable component. So if I save that, it's gonna, I've already got a lab machine in here, but if I save this as a lab machine and replace it, what that does is it now stores all that inner working and everything else in that one building block. And within my simulation, I can then come in here, and this happens, this is now there when you open any simulate file. You can just drag your lab machine on, and that makes it really easy to input that into any system. So there's a few different techniques that I hope are useful. If you'd like to know more information about any of those techniques or anything else I've spoke about today, we'll make sure we give you the option to get in contact. So thanks very much for listening. I've enjoyed speaking to everyone today. I hope that's been informative. Does anybody have any questions?
Thanks very much, Tom. That was great, really interesting. There's one question that's come in, which I'll ask on the person's behalf. Is how long does it take you to build a lab sim? I know you've talked about several there, so I imagine they're different.
I mean, yeah, it does vary quite a lot. It depends what you're trying to do, I guess. If you're looking at building a whole new lab with a whole new layout, it's going to take longer than if you're building a system where you've already got the system and you're just testing out a few different machines in different configurations. So, I mean, you can build a lab flow and get results from it really quickly within maybe half a day. But we have some projects which, you know, where we're building these reusable components where you might be working on them for a couple of months before you have the final polished version. But I think what's important to remember with those types of simulations where you're building a lot of detail into it is you should be looking to get value at all stages of that, especially as the simulation is very visual and it does help with communication. Even if you're spending a couple of months refining the simulation, you should be getting value from it the whole time.
Okay, thanks, Tom, and thanks very much to the questioner. We've got another question now, and thanks very much for posting this. It's, can you change the timescale in time and system graphs? They seem to be odd numbers of minutes instead of, say, hours.
Okay, so yeah, so that feature, the timescale that it uses is based on your simulation clock. So if you've got your simulation clock set to minutes, it's going to automatically use minutes. I mean, there are ways of building those graphs slightly differently so that you can put in any scale that you want. The default is just whatever scale you're using for the simulation though. So there are some features that allow you to build graphs. It takes a little bit longer than just using the default ones, but that is something that is a good thing to mention, because it's something that I could certainly take to our development team and see if there'd be a way to make that automatic for the default graphs as well.
Okay, that's a great suggestion there. And please do, people listening, if you've got any questions, please do post those. One other that's come in is that if you were thinking of merging a number of labs over a wide geographical area to get some efficiencies, how would you approach that project?
Yeah, so when you've got that type of project, I always like to start by building what the labs currently look like. So if I've got 3 different labs, I want to see how they're all performing individually first. So I like to build them with all the inputs that they have for their current system. What that does is it helps you to validate a lot of the inputs as well, because you'll know how those individual parts of the system work. So you can build all those inputs and those arrivals and things like that, validate the system, and then it's just really a matter of reorganizing your arrivals that you've already built into the one flow with the configuration that you have. I'd always start by trying to build a baseline that matches the real system, because then you can, 1, validate it, and 2, it will give you a lot of the inputs for the new system.
Okay, thank you very much. That's really helpful, and thanks to the questioner as well. Okay, so I think that's all the questions that we've got. If you have any other questions, please do send them in. I think we've got our email there, info@simulate.com, there's another question that's come in. I think we've got time for this. Thank you very much. What do you usually use to randomise the arrival volume other than the day planner? So in this anatomic path lab, we have some bunching, but it's still random.
Yeah. So if I mean, there are a number of different distributions stored within Simulate. Let me see if I can hop in and show you. So within any simulation, we want to account for the variation that happens in a real system. Hopefully you can still see this screen. Now there's lots of different distributions within the software that are built in, and don't quote me on this, but I think there are 14. So if we use some of them, like a fixed one, then that's going to show that there is going to be no variation. Now that we know that doesn't really reflect reality at all. But a lot of these other distributions will automatically build in the variation that you're going to see in real life. You tend to see with a lab a lot of arrivals that are all pretty close to each other, with maybe the odd few that are spaced out more, possibly because of deliveries coming in, or maybe if certain changeover activities need to happen. So something like an exponential distribution, where we have a lot of arrivals all quite close to each other, and then some arrivals more spread out, can be useful. Another way that you could do it is you can actually use a schedule as well, and what that does is if you could put in your exact historic data and see how that exact flow would work with a change. That method won't give you as much flexibility to test different arrival patterns, but if you're just looking to test it against what would have happened, that can be a really good way to do it too.
Great, thanks Tom. Any other questions? Oh, and thanks from the questioner there. Thank you so much. So any other questions, please do post them through to Tom. Tom, are you happy to take questions if people think of them after the webinar?
Yes, absolutely. Hopefully we can get everybody my contact details for that. I'm getting a nod in here, so I think we'll do that. And yeah, by all means, just email me if you have any further questions.
Also, just to mention that we do have this LinkedIn site, Simulate in Health, and it's partly for us to tell you about things that we're doing in case you're interested, but it's also for you to share your experience of simulations and talk to each other. So if you have questions, do also post them on there, because you might find you'll get some answers from Simulate, but also you might get some answers from other people who've done that, which hopefully will be useful for you. So thank you very much indeed to Tom for the presentation today. Thank you to you all for attending. We really appreciate your time, and it was great to have that bit of discussion. We look forward to talking to you again, and I think our next webinar is scheduled for next month, and I think we're hoping to hear from Memorial Healthcare talking about some of their work on healthcare facilities. So I'm excited about that. So thanks very much. Great to talk to you, and hopefully speak to you again soon.
Thank you.